Jenny. I'm going to be your nurse today. Can you tell me your name?
Joshua Harden,
Okay, your age?
12.
Okay, well, today we're going to be doing an assessment of your head, face, eyes, ears, nose, throat, and mouth. And let's start by sanitizing. Okay, now I'm going to start my assessment. First, we're going to assess your head. We're gonna inspect and palpate. If you feel any tenderness, let me know. I'm looking for any lumps, swelling, lesions, cuts, sores, anything that could be in your head. I see there's no dandruff. Your hair is soft. It's brown in color. Okay, so next I'm gonna go ahead. I'm gonna look at your face. I'm looking to see that it's symmetrical. So your eyebrows, eyes, nose, mouth, ears, all are symmetrical. So now I'm gonna go ahead and I'm gonna go to looking at cranial nerve 5. I'm going to get you to go, which is trigeminal. So I'm going to get you to go ahead and I'm going to get you to open your mouth, close it. Okay, I'm going to get you to clench your teeth. Okay, thank you. Now I'm going to do cranial nerve 7, which is facial. So I'm going to get you to go ahead and we're going to smile, and frown. Okay, and puff your mouth. Okay, good job. I also got to do the temporal artery. If there's any pain, let me know. Okay, stop where everything feels good there. So now I'm going to go ahead and I'm going to move to your eyes. So I'm checking to see if there's any leakage, drainage, swelling, anything within your eyes. If they're symmetrical. I'm going to go ahead. Sorry, this is the only light I have. So we're going to go ahead and we're going to check your conjunctiva. It's nice and pink. Your sclera is white. Your iris is light brown, hazel in color. You can also check for pearla. So I'm going to, okay, your pupils are both equal round after Soraya foundation. I'm going to go ahead and I'm going to check cranial nerve 2, which is optic. I'll get you to read this.
I love you.
Okay. Now I'm going to also check cranial nerves 3, 4, and 6, which is ocular motor, trochlear, and abducens. I'm going to get you to follow this pin with your eyes. Do not move your head. Okay, look at the wall. Don't move your head and look back at the pin. Perfect. Okay. Now I'm going to go ahead and I'm going to go to your nose. So I'm checking to see if it's symmetrical, which it is. I'm looking. There's no leakage, swelling, no coming from your nose, no bruising noted. I'm going to get you to put your head back. I'm going to check your nasal mucosa. It looks fine. Septum looks good. It's not deviated. Okay, that's good. I'm going to get you to go ahead and put your finger over one nose and breathe in and out. Okay, do the opposite side. Okay, good. Both your nails are patent. Now I'm going to go ahead and we're going to check cranial nerve 1, which is olfactory. Close your eyes. I'm going to get you to smell something. Tell me what it is you smell.
Alcohol.
Okay, thank you. That's good. So now I'm going to go ahead and I'm going to check your ears. And I'm basically first looking to see if they're symmetrical, which they are. And I'm going to inspect and palpate. Tell me if you feel any pain. We're checking for any leakage, drainage, swelling. I'm going to look inside, make sure there's no fluid inside your ears. No swelling, everything looks good. So I'm going to go ahead and we're going to check cranial nerve 8, which is acoustic nerve. Cover one ear and I'm whispering something in your ear.
Football.
Okay, let's try the other side.
Basketball.
Okay, that's good. So now we're going to go ahead and we're going to go to your mouth. So I'm looking. First, it looks symmetrical. Everything looks good. Your lips are not cracked, swollen, bruised. Your lips does not have any fever blisters or sores on them. So I'm going to get you to open your mouth. Okay, looking inside. There's no sores, swelling, anything. Your teeth are white. There's no broken or cracked teeth. Hard palate, soft palate looks good. Mucosa looks good. Tongue good. Everything inside your mouth looks good. That's great. So now at this point, then I'm going to go ahead and I'm going to check cranial nerve 9, which is Glossopharyngeal nerve, and I'm gonna get you to swallow. Okay, thank you. Then I'm gonna do cranial nerve 10, which is vagus. Get you to open your mouth. Say ah. Okay, perfect. Now I want to check cranial nerve 12. So stick your tongue out. Move it side to side. Okay, that's good. Stop. Okay, now you can say light, tight, dynamite.
Light, tight, dynamite.
Okay. Now with that done, now we're gonna go ahead to your neck. So I'm looking, inspecting first. I'm gonna feel, palpate. Tell me if you're feeling any pain. Checking your trachea. Make sure it's not deviated. Everything looks good and in line. Now I'm gonna go ahead and I'm gonna go and check your lymph nodes. So we're gonna start with as I say the lymph nodes, I'll go ahead and point and say at the same time. So we got preauricular, postauricular, we got submandibular, submental, we got gastrite. Oh Lord, I cannot say this word for nothing. I'm sorry. Juglodigastric. Okay, thank you. And then also we have posterior cervical. We got superficial cervical and anterior cervical. I'm gonna get you these shoulders like this, and we're gonna check the supraclavicular. Okay. Now all that looks good. So now I'm gonna have to walk behind you, and I'm gonna do a thyroid exam. So with the thyroid exam, I'm gonna go ahead and I'm gonna place my hands on your neck like this, and I'm gonna get you to put your head to one side, then to the other. Okay, yes, everything seems good and in line with that. And basically, do you have any questions?
No.
Okay, when one other thing, when I check this, I'm also gonna get you to swallow. Okay, yes, that feels good. So that's it. So you say you have no questions. You exam, everything looks normal and good. No abnormal findings. Thank you for your patience. Thank you for your time. You have a nice day, okay?
You too.